Imagine this scenario. You're really carefully taking 3 different blood pressure meds every day. Do everything right, but your readings are still sky high, maybe 180 over 100.
It's frustrating.
Right. And it can feel, well, pretty discouraging.
Mm-hmm.
But here's the thing, and this is important. It's not about your effort. This is actually a specific medical condition called resistant hypertension. It's kind of a silent threat, and it affects, believe it or not, nearly 20% of people with high blood pressure, particularly if you're over 60.
And that frustration you mentioned, it's completely understandable. What makes resistant hypertension particularly worrying is the impact. It significantly bumps up your risk for heart attack, stroke, kidney damage, much more so than, standard high blood pressure.
Yeah, right.
It's basically a situation where your body's own complex systems just aren't playing ball with the usual treatments.
That's a really key difference. But, and this is where we get to the good news, there's actually real reason for optimism now. We're seeing breakthrough research, especially in 2024 and looking into 2025, that's completely changing the game. We're talking revolutionary new meds, new treatment approaches that work in fundamentally different ways. So our mission for you in this deep dive is pretty clear. By the time we're done, you'll get what resistant hypertension is, how to spot it, and crucially, you'll understand the exciting, genuinely game-changing new options that are emerging.
Exactly. Hope is definitely on the horizon.
So let's start right there. For listeners maybe wondering that this applies to them, what exactly is resistant hypertension, medically speaking?
Okay, so the clinical definition is when your blood pressure consistently stays above 140 over 90. Even though you're taking at least 3 different types or classes of blood pressure medication at the right doses. And critically, one of those meds has to be a diuretic, a water pill.
Got it. So 3 meds, optimal doses, one's a diuretic, and the pressure still won't come down below 1490.
Precisely. You can almost think of it like your cardiovascular system is just, stubbornly saying no to the standard treatments we have.
And what makes it so sneaky, so dangerous?
Well, a big part of it is that it's often silent. Unlike regular high blood pressure, which sometimes gives you symptoms like headaches, resistant hypertension, frequently has no warning signs at all. So you could feel absolutely fine while inside that high pressure is doing damage to your heart, your brain, your kidneys, your eyes. It's why, especially if you're over 60, that home blood pressure monitor is so vital. It's really more important than your bathroom scale in this context. It gives you that essential window.
That's a really powerful point. Okay, so what causes this? Why does it happen? It sounds like it's probably not just one simple thing.
You're absolutely right. The causes are, much more complex than most people think, and getting a handle on them is key for managing it effectively. Surprisingly, sometimes the reasons are hiding in plain sight in our daily habits.
Like lifestyle stuff.
Exactly, but it's how those lifestyle factors change with age that's really striking. Take salt, for instance. Younger folks might handle, say, 3,000 milligrams of sodium a day, okay, but someone over 60, their blood pressure might jump with just half that amount. Our sensitivity really increases.
Wow, half. That's significant.
It is. And same with alcohol, our metabolism changes, so what might have been fine years ago could now be contributing. Plus, the usual suspects. Excess weight really strains the system, and being inactive makes the heart less efficient over time.
I didn't realize those age-related shifts were quite so dramatic.
Yeah.
And you also mentioned medication interference. Beyond blood pressure drugs themselves, even things you buy over the counter.
Oh, absolutely. That's a big one that often gets missed. NSAIDs, that's non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, they can seriously interfere with your prescribed blood pressure meds.
Really? Like ibuprofen for arthritis?
Yep. I've actually seen patients whose blood pressure improved quite a bit just by switching from ibuprofen to acetaminophen for their pain. And it's not just NSAIDs. You've got to look at things like nasal decongestants, certain herbal supplements, ginseng. Licorice can sometimes be culprits, and even some antidepressants can sort of quietly push those numbers up.
That really drives home the need to look at everything someone is taking. Okay, so beyond lifestyle and other meds, are there underlying medical issues that can cause this resistance?
Yes, definitely. If we look at the bigger medical picture, some secondary causes become much more common as we get older. Sleep apnea is a huge one.
I've heard about that connection.
It affects maybe up to 40% of people over 60. Those repeated pauses in breathing during sleep, they trigger stress hormones, and that spikes your blood pressure. Treating it with CPAP can actually lower BP by, say, 5 to 10 points.
That's quite a drop.
It can be. Then there are kidney problems. Kidneys just tend to get less efficient with age. And a specific issue, renal artery stenosis, basically a narrowing of the arteries going to the kidneys, is more common after 60 and can cause really severe resistant hypertension.
Okay.
And one more to mention is primary hyperaldosteronism. That's where your adrenal glands make too much of a hormone called aldosterone. It's surprisingly common, maybe found in up to 20% of resistant hypertension cases, often missed because the symptoms can be subtle, but it's very treatable once you find it.
So putting it all together, who's really at the highest risk for developing this resistant type?
Well, we definitely see higher rates in certain groups. African Americans tend to have higher rates, people with diabetes, those with chronic kidney disease, and women over 60 seem particularly vulnerable. It's often like a perfect storm of factors: aging blood vessels, hormonal changes, maybe some accumulated damage over time all coming together.
And just managing all those pills, that must be a
Yeah.
challenge in itself too.
Oh, absolutely. Medication adherence is a real factor. Some studies suggest maybe up to 40% of people diagnosed with resistant hypertension aren't actually taking their meds exactly as prescribed. Now, this isn't about blame at all. I mean, juggling multiple pills, maybe dealing with side effects like dizziness or fatigue or having to run to the bathroom all the time. It's genuinely tough.
Right.
But making sure someone is taking the prescribed meds correctly is, the essential first step before we jump to more advanced treatments. The big takeaway here, really, is that resistant hypertension isn't some kind of personal failure. It's a complex medical issue with lots of potential contributing factors. But figuring out those factors, that's the first powerful step towards getting control back and protecting your health long term.
That's a really clear and, I think, hopeful way to put it. Okay, so when the standard stuff just isn't cutting it, what are the more specialized strategies? What can really start to shift the needle?
Well, the very first step, always, is to really optimize the medications you're already on. Your doctor needs to double check. Are you on the right combination of those three main classes? Usually that's a diuretic, an ACE inhibitor, or an ARB, and a calcium channel blocker. Are the doses truly optimal? Is the timing right? Getting that foundation absolutely solid is crucial.
Right, makes sense. And assuming that's all optimized, there's one drug that seems to come up a lot now: spironolactone. It's often called a hero or game changer here. Why is it so effective in these tougher cases?
Spironolactone's strength comes from its specific mechanism. It's what we call a potassium-sparing diuretic, but its main job here is blocking the effects of aldosterone. Remember that hormone we talked about? It makes your body hold on to salt and water, which drives up pressure. So spironolactone directly counteracts that. That's why recent guidelines, like the 2024 European Society of Cardiology ones, now point to it as a preferred add-on therapy. And the results can be pretty impressive. Studies show it can lower systolic blood pressure by, on average, 15 to 25 points when you add it to that standard triple therapy.
Wow, 15 to 25 points is huge in this context.
Sure.
Are there things to watch out for when using it, especially maybe in older adults?
Yes, absolutely. It's powerful, but it does need careful monitoring, especially in seniors. The main things are potassium levels. It can cause potassium to go up, sometimes too high, and it can occasionally cause breast tenderness or enlargement. So typically, especially for older patients, we start with a very low dose, maybe 12.5 or 25 milligrams a day, and keep a close eye on kidney function and those electrolyte levels, particularly potassium.
Good to know. Now, moving beyond pills.
Yeah.
You hear about these newer device-based treatments. That sounds like a completely different approach.
It really is. These device therapies are quite revolutionary, actually. Renal denervation is probably the best known one right now.
How does that work?
It's a minimally invasive procedure. They use either radiofrequency energy or sometimes ultrasound, delivered via a catheter, usually inserted through the groin, to basically quiet down overactive nerves leading to the kidneys. These nerves play a role in driving up blood pressure.
So you're interrupting that signal.
Exactly. Think of it like interrupting a faulty communication line between the kidneys and the brain that's keeping the pressure too high. And recent big trial studies like Radiance-HTN, Spiral-HTN, they're showing consistent drops in systolic pressure, often in the range of 8 to 15 points, sometimes even more. And these effects seem to last for years.
Who's the best candidate for something like that?
Generally, it's for people with truly resistant hypertension who've already tried multiple medications without success. Then there's another device approach called Barriflex activation therapy. This involves implanting a small device, kind of like a pacemaker, that stimulates specific sensors in the carotid arteries in your neck. These sensors, called baroreceptors, naturally help regulate blood pressure. So stimulating them basically tells the brain to lower the pressure. It's like boosting your body's own natural control system.
Fascinating stuff. Almost sounds like science fiction. But let's bring it back down to earth for a second. With resistant hypertension, how important are those lifestyle changes we talked about earlier?
Yeah.
Do they become more critical?
Oh, absolutely. If we connect this back, lifestyle isn't just a nice-to-have supportive measure here. It becomes even more fundamental, and often the impact can be even greater when you're dealing with resistance. Take the DASH diet, lots of fruits, vegetables, whole grains, low-fat dairy, really limiting sodium. That alone can lower systolic pressure by maybe 8 to 14 points.
That's significant.
It is, and for people over 60, because of that increased salt sensitivity, I often push for aiming even lower on sodium, maybe around 1,500 milligrams a day, not just the standard 2,300. Regular aerobic exercise doesn't have to be intense. Even 30 minutes of brisk walking most days, it acts like a daily dose of medicine, potentially lowering systolic pressure 4 to 9 points.
Exercise is medicine, I like that.
And weight management is key too. Rough rule of thumb. Every kilogram, or 2.2 pounds, you lose can lower blood pressure by about 1 point. So losing 20 pounds could mean close to a 10-point drop. Tackling sleep apnea with CPAP, if you have it, that's another 2 to 10 points potentially. And don't underestimate stress management. Things like meditation, deep breathing, yoga, tai chi. Consistently doing those can knock off another 5 to 8 points.
So it really adds up. It's not just what you do, but doing it consistently, smartly. What about fine-tuning the meds you're already taking, beyond just the type or dose?
Great question. Yes, optimizing how you take the meds matters too. There's something called chronotherapy, basically, medication timing. Research shows that taking at least one of your blood pressure pills at bedtime, instead of all of them in the morning, can often lead to better 24-hour control and even reduce cardiovascular risks. Well, blood pressure naturally tends to dip while you sleep. It's called nocturnal dipping. Taking a med at night can help maintain that healthy dip pattern. Also, it goes back to that careful review of everything you take. Prescription, over-the-counter, supplements, herbals, systematically going through it all. Sometimes, like we said, switching an NSAI to acetaminophen or maybe changing from an immediate release drug to an extended release version can make a difference. And of course, systematically checking for those secondary causes is vital blood tests for that aldosterone condition, maybe imaging for the kidney arteries, a sleep study for apnea. Treating an underlying cause, if you find one, can sometimes completely resolve the resistant hypertension.
Okay, so bringing all these strategies together, optimizing meds, devices, lifestyle, what's the ultimate goal for the listener here, beyond just hitting a number?
Right. The goal isn't just about lowering the numbers on the machine, though that's important. It's really about long-term protection. Protecting your heart from strain, protecting your brain from stroke risk, protecting your kidneys from damage, and ultimately preserving your overall quality of life for many, many years to come.
And looking forward, it really feels like the landscape for treating resistant hypertension is about to change dramatically. There's genuine excitement.
Right. Absolutely. What's truly generating buzz is a drug called Baxdrostat. This could be the most significant step forward in blood pressure treatment in decades.
Why is it so different?
Because it works via a completely new mechanism. Unlike spironolactone, which blocks the effects of aldosterone, Baxdrostat actually blocks the enzyme that produces aldosterone in the first place. It gets right to the root cause for many people with resistant hypertension.
So it stops the hormone from even being made.
Exactly. And the phase 3 trial results, the big study needed for approval, called Baxhtn, reported in July 2025, were frankly remarkable. In patients with hard-to-control hypertension, it showed an average systolic blood pressure drop of about 17 points compared to placebo.
17 points. That's massive.
It really is. And the benefits seem sustained, with really good tolerability. For older adults, the safety profile looks particularly good, minimal side effects, besides maybe a small, manageable increase in potassium. It really has the potential to be a game changer. We're expecting possible FDA approval late 2025, maybe early 2026. It would be the first totally new class of blood pressure drug in over 20 years.
That's incredibly exciting. And there's another newer one already out there, right? Aprocitentan.
Yes, Aprocitentan, brand name Trivio. That got FDA approval back in 2022 and has been available since late 2024. It works differently again. It's an endothelin receptor antagonist.
Meaning?
It blocks endothelin, which is a substance in the body that makes blood vessels constrict or tighten up. So blocking it helps vessels relax. The main trial, called Precision, showed it lowered systolic pressure by about 3.7 to 4.2 points more than placebo.
Okay, that sounds smaller than Baxdrostat.
It is a more modest reduction numerically, but, and this is crucial for people with truly resistant hypertension, every single point matters enormously. A 4-point drop isn't trivial. It translates to roughly a 15% lower stroke risk and maybe a 10% lower heart attack risk.
I have to put it in perspective.
Exactly. The advantage of aprocitentan is its very targeted approach, just blocking those specific receptors, which tends to mean fewer side effects compared to some older, broader-acting drugs. And we're also seeing continued improvements in renal denervation, that device therapy. The latest studies are showing really consistent, meaningful BP reductions, like we said, 8 to 12 points systolic on average, but some patients see much bigger drops, over 20 points. And the key thing is, unlike some meds where the effect can wear off, the benefits from denervation often seem to improve over time. Plus, the technology itself keeps getting more precise and even less invasive.
And you mentioned something truly cutting edge, artificial intelligence playing a role. How does AI fit into treating blood pressure?
Yeah, this is where it gets really interesting for personalization. AI algorithms can now analyze huge amounts of data, your specific response to past medications, maybe genetic markers, your overall health profile, and use that to predict which treatments are most likely to work best for you.
So moving beyond just trial and error.
Exactly. It's helping us move towards truly personalized medicine instead of a one-size-fits-all approach. And this isn't just theoretical. AI tools are already being used in some major medical centers to help doctors make better treatment decisions.
It's a massive leap. Are there other research avenues looking promising further down the line?
Definitely. The pipeline is pretty active. Gene therapy is actually moving into early clinical trials, looking at modifying specific genes for long-term blood pressure control. That's still years away from widespread use, but the concept is powerful.
Wow.
There's also research into new combination pills, poly pills, maybe combining existing drugs in new ways or even including some of these newer classes. And finally, the integration of digital health, think smart blood pressure cuffs that sync with your phone, medication reminder apps, wearables tracking activity, and sleep. All this data can help create a much more precise, personalized, and continuously monitored treatment plan.
It sounds like the pace of innovation is really picking up. With Baxdrostat potentially by 2026, these newer devices improving, AI already being used, it feels like a really hopeful time.
It absolutely is. There's a robust pipeline. The core message I really want you, the listener, to take away is this. If you are struggling with resistant hypertension, please do not lose hope. The next few years are going to bring treatment options that simply didn't exist before. It offers real, tangible, new possibilities for getting blood pressure under control and protecting your long-term health.
That's a fantastic note to build on.
And as we kind of wrap up this deep dive, I really want to reinforce that point. Having resistant hypertension does not mean you're stuck with uncontrolled blood pressure and all the risks that come with it. Honestly, we are living through probably the most dynamic, exciting time in the history of blood pressure treatment. These breakthroughs, like Baxdrostat, like Aprocitentan, they offer genuine renewed hope.
And it's so important to remember, like you said, even seemingly small improvements matter hugely. That 5-point drop in systolic pressure we mentioned, it might not sound like much, but reducing stroke risk by 14%, heart disease risk by 9%, that's massive. Especially when you consider that resistant hypertension often means someone's running 20, 30, maybe more points above their target. Getting those kinds of reductions can radically change your long-term outlook.
Absolutely. And those consistent lifestyle changes we talked about, the walking, managing stress, the dietary tweaks, especially sodium, they aren't just side notes. For resistant hypertension, they can be truly transformative foundations for everything else. So please, don't give up. Work really closely with your healthcare team. Be an active participant. Ask your doctor specifically about these newer treatment options. Ask about maybe seeing a hypertension specialist. Ask if clinical trials might be relevant for you. Your advocacy, speaking up for your own health, it matters enormously, especially now with all these evolving treatments.
That's such crucial advice. The future really does look brighter than ever for treating resistant hypertension, and you absolutely deserve to benefit from that hopeful future. So stay informed, keep talking with your healthcare team, and truly don't lose hope. Better days are definitely ahead, and better treatments are coming. And just a reminder, this information is for educational purposes only. It's not a substitute for professional medical advice. Always talk to your own doctor before making any decisions about your health, especially if you have existing conditions or are taking any medications.